many of you know that some medication actually make your existing health condition worse? Yes, you heard me right. Some medications can actually interfere with your medication that you've been taking and making your health worse than before. It is called drug-disease interaction. Drug-disease interaction, where the disease can be aggravated by taking certain medications. It can often happen than people realize. Let me give an example. Hi, I'm Lakshmi, pharmacist and inspirational coach. I can help you to manage your medications, manage your stress, manage your thoughts, manage your mind, so that you can take control of your health in a holistic way. In this example, the patient has a sore throat, severe nasal congestion, watery itchy eyes, and fever. She went to the urgent care. The doctor diagnosed her with upper respiratory infection. Doctor asked the patient if she has any health conditions that he has to know, if she has any medications that she's been taking, so that he knows if when he's prescribing the medication has any interaction with the health conditions or the medication she's been taking. Patient denies, saying that she doesn't have any health conditions, she doesn't have any medications. So doctor cleared that she doesn't have any complications to take the azithromycin and prescribed the azithromycin medication to her, because it's very simple regime. It's 5-day course, 2 tablets on the first day and rest of the days once a day, and it's done. It's a very simple regime. Compared to the other antibiotics, patient might have to take 2 to 3 times a day, and probably duration would be 7 to 10 days. So doctors prefer to give less number of days so that patient can complete the therapy or complete the course. So doctor prescribed the azithromycin. Patient knows few months back she has some heart issues. She went to the hospital. They diagnosed her with some kind of heart problem. She doesn't remember, and she's not taking medication at that moment. So she thought it's not necessary to tell the doctor about it. And she left the doctor's office. She went to the pharmacy. By the time she left the urgent care, her regular pharmacy is closed. So she went to the nearest pharmacy at the urgent care. The new pharmacy asked the patient if she has any health conditions they have to take care or to be noted. If she has any medication that she's been taking, to be noted on the pharmacy records. Patient denies taking any medications or having any health conditions. And pharmacy process the prescription, dispense the medication. While dispensing the medication, pharmacist consult that take the medication with the food so that she doesn't get the stomach upset. And she can start the medication that night. So patient started taking the medication at night. She takes first day 2 tablets as doctor suggested, and then she take the next day evening at the same time 1 tablet. On the third day she started having swelling, chest pain, shortness of breath. She has to rush to the ER, and they diagnosed her with the heart failure. What happened here? The simple drug-disease interaction. When the doctor prescribed, he doesn't have any knowledge of that. She has previously diagnosed with the congestive heart failure. Pharmacist is not aware of that either, because patient didn't disclose any health conditions she has, except denying that she doesn't have any health conditions. And now she ended up at the ER with a heart failure. What happened here? There's interaction between health condition that she been diagnosed and the medication that now they've been prescribed, azithromycin. What is azithromycin did? Azithromycin mechanism is when it acts in the heart, it increases, it interferes with the electrical conductivity of the heart, increasing the QT interval prolongation, where the patient with arrhythmia or congestive heart failure can get worse. The symptoms or the disease condition get worse. That's what happened in this patient. Her heart problem got worsened by taking this azithromycin. So it's very, very essential. Let your doctor know what medications you've been taking, what health conditions you have. Have the list of your medications. Have the list of your health conditions so you can show it to your doctor. And all the time, ask your doctor or the pharmacist if it's okay to be taken this medication with the health conditions that you have, with the medication that you've been taking. And also, I always suggest my patients, if they've been taking any new medication, and if they notice, observe any side effects that are unbearable, and they think that might be troubling them, call the pharmacist or call the doctor. It could be simple side effects that might wear away or wear off after a few days of taking. It could be life-threatening at times. So it's very, very essential to share your history of your medications, to share history of your health conditions, so that when the doctor prescribing, he can check for interactions. When the pharmacist is checking, they can check for interactions, and if it's necessary, calling the doctor to change your medication. In my practice as a pharmacist, many times I have called the doctor to change the medication. They're not aware of it. They're not doing anything wrong. They're not aware of the medication or the health condition the patient has. So they prescribe the medications. As soon as they heard from us, they change the medication right away. It's not like medication is not safe. Medication is right medication. But the disease put the medication at risk, making it harder, making it worse the disease the patient has. So this is drug disease interaction. If you have any questions on this video, please let me know. I'm a coach. I'm also a pharmacist. As a pharmacist, I can manage your medications. As a coach, I can help you train your mind and body to take control of your health in a holistic way. If you have any questions, or if you want some other medication to be, interactions to be learned, just send me a message in the video. Please like and subscribe. Thank you.